Amer Raza. I'm a consultant gynecologist and endometriosis surgeon in Government Hospital. And today I want to talk about adenomyosis. Adenomyosis is a condition which affects millions of women. It's a condition in which tissue lining the uterus called the endometrium grows into the muscular wall of the uterus known as myometrium. This abnormal growth causes the uterus to enlarge, thicken, and become inflamed, leading to painful and heavy bleeds. As the tissue invades the muscular layer, it creates small pockets and trapped blood, causing further pain and discomfort. While endometriosis involves the tissue outside the uterus, adenomyosis occurs within the muscular wall of the uterus itself. However, it is not uncommon for women to suffer from both conditions simultaneously, which can further complicate the diagnosis and the management. Adenomyosis is far more common than many people realize. It affects between 25 and 35% of the women offering to reproductive age. However, this number may be higher due to underdiagnosis. Most women are unaware they have adenomyosis, but the symptoms can often be mistaken for normal period pains or other gynecological conditions such as fibroids. Adenomyosis symptoms can vary, but the most common symptoms include chronic pelvic pain that worsens during the periods. It could be heavy and prolonged bleeding. It could be severe menstrual cramps as well. Patients can also complain of pain during the intercourse, along with bowel syndrome such as bloating. And in some cases, difficulty in conceiving could be an issue as well. For many women, pain is a debilitating pain affecting their daily life. We diagnose the endometriosis with ultrasound scan. Ultrasound scan still remains the first line treatment. During ultrasound scan, we can characterize the thickened ejection zone, and there could be small cystic areas in the myometrium tissue which can cause pelvic pain. MR scan can also help to know the extent of endometriosis by evaluating the ejection zone. Adenomyosis can have an impact on fertility, and we think it could be due to that adenomyosis can cause a problem with implantation of the embryo, and this can lead to rectal miscarriage or even difficulty in conceiving in the first place. However, after successful treatment, many women will go on to get pregnant without any problem. The treatment approach for adenomyosis depends if the woman is trying to conceive, and in that case, a medical hormonal treatment will suffice. For this treatment, the progesterone on the pill, Dynagest, and similar hormonal treatment can help to improve the symptoms effectively. The new drug called Ryco can also be helpful for such a condition. However, if someone has completed their family, in that case, surgical option can also be contemplated, which could be of two types. Adenomyomectomy, which is to remove the lump of adenomyoma from the uterus, or in some cases, hysterectomy can also be considered. Hysterectomy is not the cure of all the problems, but can help the symptoms significantly. Even in childbearing age as well, removal of the adenomyoma can be considered after considering all the pros and cons. The procedure is done with a minimal access technique, and in our case, it is done robotically, which gives us the precision and a quicker recovery for such an operation.